Hi, Paul.
Hey, Daryl.
Hey, so Paul, for our audience, is a Malecare Support Group leader and has been for over 7 years. He's out as a gay man, and he came to Malecare when he was diagnosed with prostate cancer. Has a master's in psychology and leads our group in prior to COVID, led one of our New York City groups, and now leads one of our virtual Zoom-based groups. So thank you for being part of the conference today.
Glad to do it.
Sure. So tell us like insights from the group. I mean, 7 years is a long time to be working with, and it's a gay men and prostate cancer group. What sort of things have you learned from the guys as far as the ability to feel comfortable talking to doctors?
In talking to the doctors, I thought you were going to go for the part about feel comfortable being in the group, because that's also part of it, but feeling comfortable with the doctors. Many times, people don't even think to ask the doctor about the general questions, as well as about pride community questions. So it gives them a chance to think about what they want to ask, and we encourage them to write down what questions they have, or to bring their husband with them to the doctor's office, so that they have another set of ears, sometimes a partner, sometimes a friend. And that can add some comfort too, because when you have difficult questions, and maybe from pride community questions, you have a little more support in the office. But I think just writing it down and being aware ahead of time what the topics are, then they can cover it in a more efficient manner with the doctors.
And we'll get into what those questions are in a minute and a half to 3 minutes or so. So, but I mean, from what you're hearing in the group over the last 7 years, uh, I mean, have doctors gotten better or worse in speaking to gay patients?
I believe they've gotten better. It's not there yet, but everything is a stepwise process. I think in general, our society is becoming more aware, hey, there's more people out there than just me, just my type. And so I think doctors are individually becoming more aware of the fact that there's a pride community out there, and that they need to think about that. And then I think hospital systems, medical systems, we're seeing on questionnaires, how do you identify? How do you prefer to be referred to, et cetera, et cetera. So that helps. And that's a start, so that the doctor doesn't just have one agenda, but thinks, okay, this goes broad. And that's a start, but it doesn't necessarily mean that the doctor is versed in everything from the pride community.
Yeah, but is what you said backed up by what you're hearing in the groups?
I hear that somewhat in the groups, but I've just been noticing that as a patient myself, and seeing how hospital systems work.
Sure. So what are the things that the guys, I mean, I guess a good primary question to start this conversation off is, why have a gay men with prostate cancer group? Why not just a prostate cancer support group?
Well, first of all, whether it be gay men or any other separate group, we all have individual needs, and things that are specific. Plus, it's getting better, but again, just the feeling of being an out group, we're not necessarily understood in the general population. So somebody understanding who we are, and there's a sense of security of being able to talk to other people who have similar experiences or can understand what you're saying. When my own personal experience, I've attended groups that you've conducted, Daryl, and I've attended some other general meetings about prostate cancer, and they're very good. They tend to focus on the medical and the practical. We're finding that straight men don't necessarily, not everybody, but don't necessarily as a group speak about their lifestyle and their emotional part of it. And I just in comparing, contrasting, I see that the guys in the pride community groups tend to talk more about their life experience, lifestyle, how it impacts their partner, sexual problems that they're having, more specific, more candid.
Yeah. And do you think that would occur if it were like a diabetes and gay men group, or any like a group about that is concerned about a disease that doesn't necessarily impact sexual functioning and urinary incontinence and things like that?
That's a good question. I would guess there would be some validity to that, just because, again, I think as a stereotype, I think that gay men are more likely to be expressive about their emotional conditions and their backgrounds. So they might have more empathy even about diabetes or some other disease state.
Yeah. What makes a gay men and prostate cancer group safe for gay men, for men from pride community to show up and speak?
If pride community people are in the same room together, they will feel, okay, I'm not saying anything that this is going to get around or be chastised from the outside world. I think a lot of this, I think a lot of things have eased up, but being a man who came out in the 70s, there was a lot more pushback. And I think there still is. We see a resurgence of groups who resist. There's only one way to be. And so, but it's also the freedom of talking about subjects that we know experientially firsthand. And that's different than even someone else who sympathizes but doesn't experience that. For instance, there was a fellow in my group who went to a nurse practitioner. It was terrific. I'd interviewed her myself. Very knowledgeable, very kind, very empathetic, but she didn't know firsthand, first, what it is to be a male, much less to be what it is to be a gay male. And so that was problematic to one of the respondents in the group.
Yeah. So within the gay group, you've described, or the pride group, let's call it that, for which is more inclusive, I think, and I think you agree. Pride is actually you came up with that term for Malecare, that we're helping the pride community. The idea that there are emotional and social discussions that go on. Um, Okay, but what are the unique medical concerns that gay men with prostate cancer have that straight men don't?
I think a large part of it isn't necessarily different behavior so much as um, sort of a physical understanding of what it is to be male with male, even though the equipment may be the same in other situations. And the fact that, again, with the 1970s and the sexual revolution, the freedom to do that, I think that was a shared experience, because most of the men who come to our group, because of when people come diagnosed with prostate cancer, it tends to be later in age. So that's another factor that unites us, having a similar socio-economic background, a similar social culture background rooted in the 70s. And so some of the things we experienced in those days, and I would think one of the few things that differentiates for some of, not all, but for some of the men in the group, anal penetration is a factor that would not be the same in a heterosexual situation. But as I say, that's for some people. Most of the time, it's just talking about a male-to-male experience that is that's different than heterosexual, simply because it's male personalities together.
Yeah, the male personality, just as critical as whether or not you have a prostate to enjoy. Just as critical to whether you're a bottom or a top. And it's a male to male personality. What is the dynamic between two men of while being intimate that is so different than a man and a woman?
Well, women tend, and this is a generalization, I'm not saying it's everyone, but in aggregate, women tend to be more emotional responders, and men tend to be more visual, tactile responders. So let's go back to the 1950s. A woman would say, oh, no, I don't want to engage any more than kissing because I need to keep chaste, and I'm not going to approach that. But you have two men who are visually and tactily attracted to each other, and there's that automatic chemistry. And so women tend to be more the nurturers, the biologically have hormones for nurturing and for childbearing. And so there's a different element where with men, which is why there's the stereotype of men just wanting to have the sexual encounter and then be finished with it and not have the emotion. That is all very stereotypical and abstract, but I think that there's an element that makes men different than women in general. Not to say, and gay men are, I would say, I don't know if they're more emotional, but they're more ready to talk about their emotions than heterosexual men, who will tend to talk about sports, will talk about things that are not about their feelings. And I mean, that's again stereotypical in TV sitcoms where the guy just wants to watch sports and the woman wants to have some meaningful conversation.
Yeah. And, having led both gay groups and, I've led gay groups, gay
Right.
men and prostate cancer groups. I've led mixed groups, for lack of a better term, where heterosexual and gay men show up and bisexual men. The rare time a transgender woman walks in, but basically it's a mixed bag of men. Um, Not once has sports ever come up in 22 years.
Right.
So I mean, the stereotype of men endlessly talking about sports, at least within a prostate cancer thing, is, from as far as I'm concerned, debunked and crap and BS. The idea is that men share more within the context of a gay group that that's spot on. I mean, there's an element of camaraderie and safety is a very key part of that. That occurs in a group dedicated to gay men, who enjoy sex with other men. That has an energy about it that just makes people feel excited to speak. Do you find that too when you're leading a group?
Oh, yes, very much so. And it's not that gay men don't have their own version of sports, but it's
Yeah,
not to deflect. It's because there's a genuine interest, just like the straight men have a genuine interest in their teams, but rather than deflect, it just adds color. For instance, in our group, I very often have to remind the guys, hey, we're here to talk about prostate cancer. And I'm just looking at the screen. It said your connection may be unstable. So if I drop out, just let me know. So I might have to remind them, let's get back to prostate cancer because they'll want to talk about the new musical on Broadway. And I say, okay, enough with gay sports. Let's move on to prostate cancer.
Yeah. And, you know, being in New York, talking about the new musical is a heterosexual thing as well as anything else.
Not
Uh,
the way these guys talk
Probably not.
about it.
No, but I mean, you know, as people from across the country may imagine, within a large urban center, you may have celebrities showing up or things like that. And at least in the groups I've led, we've had really like a remarkable number of well-known people who don't want anyone outside of the group to know, including one legendary night where we had 4 Oscar winners showing up. Not all best actors Oscar winners, but they were in fact Oscar winners, you know, sitting around a table of about 12 or 13 guys that night. The idea that gay men have questions that are unique is a good point to make. People shouldn't be afraid to ask questions that have meaning to them. They shouldn't be looking for questions that may be so general that they imagine the doctor will be happy to hear them, but really it has no relevance to their meaning of life, their meaning of their seeking of treatment. What are the specific, like the top 3 to 5 questions that you think gay men should be asking their doctors around prostate cancer?
Well, I mean, I think they need to touch base to what's going to happen before the surgery. What should I do? How should I be proactive, whether it's Kegels or medication? What should I expect during the surgery? What should I expect for aftercare? And is my prognosis for long term, and how long out is that? But what I've been seeing in the group is that the men in our particular group are not focusing on being heard, they're more focusing on being hurt. And so when they ask a question that is a pride community question about prostate cancer, they're likely to get an answer like, I don't know, or I don't know about that, or something that brushes them off and they go off hurt. So it's a little bit like in a sitcom like Home Improvement, where Tim is insensitive about something, and then he notices that his wife is kind of cool to him, and he asks her why, and she said, "If you don't know why, I'm not going to tell you." So that doesn't help to address the problem. So I think if men in the Pride community group are going to ask questions specific to their needs, if they say, do you know, or can you help me, can we find out about thus and such, that is an issue for them, I think they'll get better response rather than going off hurt and the doctor not even knowing, except that I had a disgruntled patient, but I don't.
You're right. This idea that all doctors should know everything on earth,
Right.
not
Because
really. Yeah, yeah.
I can imagine a heterosexual patient coming in where the wife or the partner would like to do some particular behaviors or such, and the doctor just not knowing what to tell them. I don't think it's just case specific, and we can't expect someone to have such a broad knowledge base. Just like I think that when a doctor is going to prescribe a medication, how would she or he know all the interactions, or etc.? They have to look it up. And thank goodness now that the UK has come out with some specifics on gay behaviors and how long to wait before a biopsy, after a biopsy, etc., etc. So there's data out there that the doctor could draw on if the patient is not drawing on him or herself.
Yeah, I mean, people complain about Dr. Google and nonsense like that. I mean, we all use Google, including doctors and clinicians and such. And good, because we want the neural network of 8 billion people on the planet to inform the things that we need to tell our patients. The opportunity to share information across mail care groups is critical too. To be able to know what a man in Waco, Texas is going through as a gay man compared to one in Manhattan or Los Angeles is a really informative and supportive conversation to have. What strategies do you think gay men from Pride communities should use in speaking with their doctors? I mean, you
Well,
alluded to it a little
as I
bit.
said, I think to make it a little more open-ended so that because anybody who's starting out with resistance or an attitude of you don't know anything about gay men, you're not going to help me, that doesn't help. So make the doctor part of it and say, can we find out what I should do about such and such, or when I can resume doing such and such, whatever their topic is, and give the doctor a little time, not necessarily to answer that moment, because as we said, the doctor doesn't have wide experience in all matters sexual. So just give them a little leeway. I think then the doctor will have knowledge for the future rather than just saying, I don't know, and that being the end of the conversation, not be able to help the next person who comes up with that same question.
Do you think it's the obligation of a gay man to teach a straight doctor what it means to be a gay man with prostate cancer?
Um, yes, but I guess I wouldn't put the word obligation. I just think it's just a smart thing to do for oneself as well as for the next person. Um, just as I think in any minority, if I need to learn about a certain minority, how am I going to learn about it? Word of mouth, oral tradition is probably the best way, better than even trying to look up specific facts. If I know that something is relevant, I'm going to pay more attention to it.
Tell me about your thoughts on what Malecare does for the Pride community.
It goes back to what you brought up before, Daryl, the fact that there's a sense of security. I would say that is top. I think it's a gift of time because on pride topics as well as general prostate treatment, we can't expect a practitioner to sit there for an hour and listen to every question we have. Um, it gives a freedom to be candid. And in a doctor's office, we may not use locker room talk or talk generally personally the way we do with friends. And a support group is a sense of friendship, so where you can relax. Importantly, I think it gives perspectives because as one attendee talks about, and I'll use the term he because it's generally someone presenting as male, he gives his perspective on how he's feeling, what his doctor said to him, how he broached it. That gives ideas to other people in the group. Oh, I never thought about that. I can bring that up. Oh, for instance, somebody in the group who was talking about time for anal, how long to wait before anal penetration. And I said, well, think about asking your doctor about when you could do a colonoscopy, when you could do an enema at home, something of that sort. So those are precursors to something the doctor would be familiar with that talks about insertion. So other guys in the group may bring up something that a particular individual hadn't thought of. So it gives, some more perspective. And then tips. Again, sitting in a doctor's office, we don't say, the doctor might say, use pads for incontinence when you're recovering from surgery. Okay, so then the person can come to the group and we say, oh, do you know about the mail pad? Do you know about this type some of the guys will even suggest, oh, just go to the feminine hygiene department of the store. They have these great pads. And that's something that they're not going to be hearing in a doctor's office.
Yeah. What do you see as the future? You think there'll always be a need for groups for Pride community alongside groups for everyone?
Probably, but I think less so as we're becoming more and more aware. I don't know the extent that our experiences will be all the same. We've seen women more able to talk since the 70s and the sexual revolution. Women are more frank about sexual experiences, etc. And I've seen when I was back in the 70s, men would only talk about to other men about their sexual experiences. Now they will share with women friends. So I think that speaks true to support groups and things of that sort too. I think it's more likely that a person presenting as gay can go to a straight group and be able to speak a little more openly than ever before. And that probably will increase. But again, just having someone beside you who knows experientially what you're talking about makes a difference as to what you're wanting to share and whether you think other people are reading it the way you intend it to be read.
Yeah. I mean, it's hard for somebody to go to speak about rimming in a heterosexual dominant group and then to bear the cringe from somebody's face, you know. And that's fortunately male care groups will be around for many years to come. Unfortunately, we have got insanely great leaders like you facilitating them and volunteering your time, and we're all grateful for that and grateful for your time today. So thank you for being here.
You're very welcome. Thanks, Daryl.
Okay, thank you, Paul.